everyone, let's discuss our today's topic. So topic for today is nephrotoxic drugs. So nephrotoxic drugs are very important to know for Nclex, as you may get any pharmacological question that asks you about which drug you will indicate or contraindicate for the patient with any renal dysfunction. So those nephrotoxic drugs, you can learn acronym, that is DAM, DAMNO. So O stands for other. What DAMN stands for, let me tell you. Here D stands for diuretic. Diuretics are the drugs that we use to excrete out water, excessive fluid from the body. Diuretics are basically given for patient with hypertension to eliminate the excessive bleeding and to reduce the blood volume in order to reduce the blood pressure of the patient. These diuretics are also administered in case of edema or fluid overload in the body. When there is pulmonary edema or any systemic edema, we used to administer diuretics. So basically these diuretics are get excreted from the body by kidneys. So if patient is having any kidney disorder, it will increase the workload on the kidneys and will damage the kidneys. So these are contraindicated for a patient with renal disorder. Next is ACE inhibitors and angiotensin receptor blockers. So ACE inhibitors and ARBs. So ACE inhibitors are angiotensin converting enzyme inhibitors and ARBs are angiotensin receptor blockers. Both these drugs falls under antihypertensive drugs. ACE inhibitors are drugs that ends with pril, so such as anapril, and ARBs are the drugs that ends with sartan, that is losartan. Next type of drugs are mycin, the drugs that ends with mycin. They are aminoglycosides such as vancomycin, tobramycin, neomycin, gentamicin. These are the commonly used mycin drugs that can be harmful for the patient with renal disorder, and these are nephrotoxic. Next are non-steroidal anti-inflammatory drugs. These drugs we use to administer to treat pain in the patient and to reverse the inflammatory response by the body. Others include radiocontrast dyes. Kidneys are the organ that will excrete them out from the body and they will increase the workload on the kidneys. So these are nephrotoxic. Next type of drugs that are nephrotoxic includes amphotericin B. It is antifungal drug, and chemotherapeutic drugs. Most of the chemotherapeutic drugs are nephrotoxic. So we have to avoid administering these drugs to the patient with any renal disorder. If you have a patient who is taking all these drugs for long duration, you should conduct renal function test of that patient. You have to measure burn levels, creatinine levels, electrolyte levels in that patient, as all these drugs can act as nephrotoxic drugs for your patient.